Hi everybody, Dr. Daniel Yinh at the Center for Musculoskeletal Function, and today we're talking about foot pain, and in particular, pain at the bottom of your foot. There's different reasons for pain at the bottom of your foot. We're going to discuss some of those, and we're also going to discuss some of the main reasons why that occurs and what we can do about it. So during a normal gait cycle, our heel strikes the ground, and then as our weight goes into our forefoot, our arch starts to give a little bit, and that give is called pronation. And we need some of that, but if we do excessive amounts of that, that's called overpronation. Our arch is formed by the different soft tissues of our foot, and with repetitive stress, some of those soft tissues can go into failure, and as they do that, they begin to let the arch collapse, and that collapse of the arch leads to flat feet, which leads to overpronation. So in and of itself, it's not necessarily painful, but it does lead to many of the painful conditions that we're discussing now. In particular, the most common is, say this is the bottom of your foot, is plantar fasciitis. Plantar fasciitis is pain from that thick fascial band that runs across the bottom of the foot, and that's supposed to give a little bit, but with overpronation, it stretches too much, and it can create pain, particularly by the heel here, on the medial portion, on the inside portion of the heel. The plantar fascia is not only there to help form the arch, but it's also there to protect some of those sensitive nerves and blood vessels underneath, and when those become irritated, you can get nerve pain such as Baxter's neuritis and tarsal tunnel pain further up here. And that is very similar sometimes to plantar fasciitis. So they can kind of mimic plantar fasciitis. On the front here, we get metatarsal pain called metatarsalgia. And we can even get pain by the small arch by our pinky toe here. All because when we overpronate, it's almost like we're taking the brakes and the shock system out of a vehicle, but for our foot. So there's a ton of stress on the soft tissues of our foot here. Another pain presentation is the tendons that form the bottom of the foot are often come from the muscles of our calf here. So as those get overstretched, they also create pain at the bottom of the foot. For people that overpronate excessively, they need to be supported into a custom orthotic. A custom orthotic is beneficial because for example, we use sole supports because they take into account even the body weight that somebody your body weight, because that way we know exactly how much give the arch is supposed to have, because we do, as we mentioned earlier, want a little bit of pronation, just not excessive pronation. On the next video, I'm going to be discussing the casting method that we use and how it compares to some of the weight bearing and some of the pressurized pads that are out there, so that we can come up with a really nice custom orthotic. If that was helpful, go ahead and subscribe and go ahead and share. And thanks for listening, and we'll see you on the next episode.